Hi, my name is Maria Celeste Paliz. Today I'm going to talk about immunotherapy in renal cell carcinoma, Ribavirin for chronic hepatitis E virus infection in transplant recipients. Definition: Immunotherapy strategies in renal cell carcinoma. Immunotherapy with checkpoint inhibitors is now considered a standard of care for the frontline treatment of advanced renal cell carcinoma. Despite better outcomes with these agents, there is still room for improvement. Further advances in treating advanced renal cell carcinoma will depend on deepening responses and extending the duration of responses to immunotherapy. Ribavirin for chronic hepatitis C virus infection for transplant recipients. Hepatitis C virus genotype 3 causes a limited infection in non-immunocompromised patients. However, it can lead to chronic hepatitis and cirrhosis in patients who have received solid organ transplants, patients with human immunodeficiency virus infection, and patients with hematologic cancers who are receiving chemotherapy.
I think the most interesting data and the one that people are very excited about is the Emotion 151 that we just heard from Dr. Bob Moser. And this is a phase 3 randomized trial that looks at bevacizumab with atezolizumab versus sunitinib in a phase 3 setting for advanced metastatic clear cell kidney cancer. So let me just give you a little background on how we treat kidney cancers or advanced kidney cancers. So certainly there has been a lot of landscape changes. In the past, if we go back even a decade ago, we really did not have a lot of systemic therapies to offer. But now we have VEGF inhibitors, so these are what we call the TKIs. And certainly we have the immunotherapy drugs, but mostly for second line right now. So with the advent of these trial, the landscape of treatment is really changing. So in this phase 3 trial, though, what they saw was a phenomenal and very compelling improvement in the progression-free survival. The overall survival is yet immature, but we are seeing that there is two co-primary endpoints. One is progression-free survival in patients who are PD-L1 positive, and in this population, there was about 40% of them, as well as an intent-to-treat population. And what they found was the PFS, for instance, for the combined therapy is in the order of 11.2 months, compared to only about 7 months for the sunitinib arm. So these are compelling data. And in terms of toxicity, actually there's not a whole lot that it's unexpected, if you will. So I think it's a fairly tolerable regimen. So I think moving forward, this is a great candidate. Perhaps, we will be seeing more this year. I think it's rapidly evolving. And the trial I just mentioned, the Emotion trial, is but one of them. Last year at ESMO, we heard about the Checkmate 214 trial, which looked at the combination of nivolumab and ipilimumab versus, again, sunitinib, and that was also a positive trial. So we are starting to see now these combination IO drugs that are pretty soon going to be changing the landscape of treatment, because right now IO therapy has largely been second-line therapy with nivolumab. So I think we are starting to see these agents move up, and not just maybe single agents, but in combination.
Hepatitis E is RNA virus. Spread by the fecal-oral route. Incubation period 3 to 8 weeks. Common in Central and Southeast Asia, North and West Africa, and in Mexico. Causes a similar disease to hepatitis A, but carries a significant mortality, about 20% during pregnancy. In general, hepatitis E is a self-limiting viral infection followed by recovery. Prolonged viremia or fecal shedding are unusual. In acute infection, IgM antibodies to hepatitis E virus are positive. Does not usually cause chronic disease. A vaccine is currently in development, but is not yet in widespread use. Thank you for watching.
Applications in medicine: immunotherapy in renal cell carcinoma. Tyrosine kinase inhibitors, sunitinib, has been the standard of care in renal cell carcinoma for many years. The phase 3 randomized trials compare new immunotherapy-based combinations with sunitinib. Going forward with the new therapies, the quality of response may become the most important endpoint in evaluating immunotherapy regimens. Ribavirin for chronic hepatitis C virus infection in transplant recipients. HEV infection evolved to chronic infection in approximately 66% of the patients and to cirrhosis in 10%. Furthermore, several HEV-induced extrahepatic manifestations have been reported in transplant recipients who are infected with HEV.
I think when we look at the treatment for advanced renal cell carcinoma, it certainly has changed significantly. In past several years, renal cell carcinoma doesn't respond to traditional cytotoxic chemotherapy, and we had the advent of the first target therapies with the VEGF TKIs, over now, I guess, close to 15 years ago, that really showed an improvement in progression-free survival. And then for a while, that was the mainstay. And then, back in 2017, we saw the first data showing that immunotherapy has a role in the frontline treatment with the presentation of that for Nivo and Ipi showing improvement in overall survival and immune poor risk versus sunitinib. And then since then, we've had other VEGF IO combinations with both axitinib pembrolizumab and axitinib adalimumab approved by regulatory agencies, given, in the case of axi-pembro, improvement in overall survival and progression-free survival versus sunitinib in all patients in the kind of risk group, and with axi-avelumab improvement in progression-free survival. And so, there's a wide variety of options to offer our patients now. With, I think, TKI monotherapy being used less and less, given this data, and both, Nivo, Ipi, Axi, Pembro really becoming a new standards of care, given the overall survival benefit in patients with renal cell carcinoma.
Hey, thank you for watching Medicosis Perfectionalis. Hepatitis E mnemonic. The E mnemonic, also known as the EU mnemonic, coming up. Hepatitis E. Remember, EU. It causes jaundice in the Far East, Egypt, and by Egypt I mean Africa. And by the way, Egypt is my home country. India, Central America. Contaminated water. Ew, contaminated is ew. Undercooked seafood. Sometimes some genotypes of Hep E are endemic in the swine. So undercooked pork can cause Hep E hepatitis. So swine, pigs eat everything, including garbage and worms. So that's ew. No offense to pigs. Fecal oral route of transmission. Sometimes it's common in pregnancy. And when it comes to pregnant women, it's fulminant. Fulminant means massive necrosis, which can lead to failure. Ew. And there is marked cholestasis in hepatitis E. Mostly it's acute. In these countries, sometimes it's the most common cause of acute viral hepatitis. Wow.
Pros and cons. Pros: immunotherapy in renal cell carcinoma. For favorable risk disease, the NCCN list, pembrolizumab, axitinib, or a single-agent tyrosine kinase inhibitor as preferred frontline therapy. Nivolumab, ipilimumab is also a possibility, providing that the patient and the doctor feel the safety profile is acceptable. Ribavirin for chronic hepatitis E virus infection in transplant recipients. A reduction in immunosuppressive therapy has resulted in HEV clearance in nearly 30% of solid organ transplant recipients with chronic hepatitis. Small case series in population have shown that short course of pegylated interferon and ribavirin as monotherapy can effectively treat HEV infection. Cons. Immunotherapy in renal cell carcinoma. The robust activity of first-line immunotherapy in patients with renal cell carcinoma has raised the bar for future therapies. To advance the field further, we now need to improve upon response quality with more durable and complete responses. Ribavirin for chronic hepatitis E virus infection in transplant recipients. When HEV genotype 3 infection occurs in solid organ transplant recipients, it can evolve to cirrhosis and may require liver transplantation. This retransplantation in patients with viremia in the liver may reinduce the chronic HEV infection.
Checkpoint inhibition, that is actually a form of immunotherapy. So that whole class of therapy, what it essentially does is ramps up your own immune system and releases the brakes that the tumor created to slow down your immune system from fighting your own cancer. It lets go of the brakes so that you can fight the cancer yourself. And when it works, it is actually astounding. It's really quite remarkable. It doesn't work for everybody, but when it works, it's really quite remarkable. Well, interestingly, checkpoint inhibition, again, this immunotherapy approach, that has exploded on the scene for bladder cancer as well. And that is rapidly changing the paradigm for the management of advanced bladder cancer. And so there's active trials ongoing right now trying to figure out exactly what space that therapy should fit in. Should it just be in metastatic disease, or does it have a role in locally advanced disease or even earlier stages? So that is probably the single biggest advance in the last couple of years, and it's just taking bladder cancer by storm.
So now let's meet some patients so we can put to work what we have learned about hepatitis E diagnostics. Our first patient is Hannah. She feels sick and had to vomit at home. She's feverish and her skin has a yellowish color. Her symptoms started 1 week ago. 4 weeks ago, she came back from Mexico when she visited family. Obviously, we think about hepatitis. Let's order lab tests. In Hannah's lab report, we can see that her liver enzyme function is significantly elevated. Furthermore, her hepatitis E tests are positive. Hepatitis E RNA is also detectable. So Hannah is suffering from an acute hepatitis E infection. Let's see our next patient. Our second patient is Pete. He suffers from abdominal pain of recent onset. In the lab report, we can already see elevated liver enzymes. Pete received a lung transplant 8 years ago. Currently, he is on immunosuppressive therapy. Furthermore, he tells us that he's a passionate hunter. Based on Pete's history, we include hepatitis E screening in our lab report. We can see that his liver enzyme function is significantly elevated. His anti-HEV antibodies are negative. However, the lab detected HEV RNA in Pete's stool. Pete is suffering from an active, ongoing HEV infection. Based on the laboratory findings, we cannot determine when Pete was infected. It may have been recently or more than 6 months ago. However, it is not important to know that. What is important is that Pete gets appropriate treatment and follow-ups. Congratulations! Now you can handle hepatitis E lab results.
Issue applied in Ecuador. Immunotherapy in renal cell carcinoma. Expectations with current U.S. Food and Drug Administration approved immunotherapies include high response rates, extended overall survival, extended progression-free survival, and durable responses in most patients. Ribavirin for chronic hepatitis E virus infection in transplant. Recipients from data from in vivo and in vitro studies suggest that HEV infection can evolve to chronic hepatitis in patients who are immunosuppressed. In a previous study, doctors found that a reduction on immunosuppression led to HEV clearance in only 1/3 of patients with chronic HEV infection.
I think it's a truly exciting time. I mean, bladder cancer has been pretty much neglected for decades. We only had cytotoxic chemotherapy that had some modest efficacy, I would say, in patients, and now we are witnessing a true revolution with the approval of 5 immunotherapies. We're still, I think, working our way through in how to best identify patients who may benefit from these therapies and how to improve these therapies. But I think we are witnessing very durable responses in a subset of patients who can benefit from these therapies for years with really sometimes minimal side effects. I think this is truly gratifying for any medical oncologist. So kidney cancer has always been kind of like a immune responsive tumor. It's really the only other cancer where we have essentially old-fashioned immunotherapy a la high-dose interleukin-2, similar to what we use in melanoma, approved with long-term benefits.
Conclusion: Immunotherapy of renal cell carcinoma. Current data suggests that nivolumab and ipilimumab or pembrolizumab and axitinib are options for frontline treatment of advanced renal cell carcinoma in intermediate and poor risk patients. Ribavirin for chronic hepatitis C virus infection in transplant recipients. These studies show that ribavirin as monotherapy can be effective in the treatment for chronic HEV infection. 3 months course seems to be appropriate duration for therapy for most patients.
The combination in immunotherapy are focused on the first line, and clearly it's the future. It's already the standard treatment with double IO, IO TKI. But the main point, we have 2 challenges. First, we have to know how to select the good combination for the good treatment, for the good patient. And we have IO-IO or IO-TKI, and we don't really know. We need biomarkers to identify a patient who will derive any benefit from this combination. And in order to identify this kind of biomarker, we launched in France a randomized phase 2 trial called Bionic, and we select patients based on molecular groups defined on frozen tumor samples, and based on these molecular groups we allocated treatment double IO nivolumab ipilimumab or nivolumab alone or TKI alone. And with this kind of approach, I think we are going to find some biomarkers of response, and the trial is closed, the inclusion of the trial are closed, and so we plan to show the first result, I think, at the end of the year at ESMO Congress, and we will see if we can try to find the good biomarkers to respond to this treatment, because we have a challenge on toxicity concern, of course, and we need this kind of biomarker-driven trial.
There are various causes of hepatitis, but today we are looking at an infectious one called hepatitis E and how it can affect you. Did you know that your liver is the heaviest organ in your body? It does several important jobs, including cleaning your blood and producing a liquid called bile, which helps digest your food. It's important to keep your liver healthy, which is why you want to avoid hepatitis, a term that is used to describe inflammation of the liver. The hepatitis E virus, known as HEV for short, can cause infection through several routes. One of these is by eating undercooked pork, wild boar meat, or pork products. Although HEV can be present in animals such as pigs, it does not normally make them ill. When it infects humans, the symptoms of HEV infection are usually mild and clear up in a few weeks. However, the disease can, in rare cases, cause serious health problems and even death. The good news is that you can reduce the risk from HEV by following a few simple steps. When cooking whole cuts of pork, wild boar meat, pork products and offals such as kidneys, make sure that the meat is thoroughly cooked and not pink when you cut into the thickest part, that it is steaming hot all the way through and any juices run clear. Practicing good hygiene is also important.